What I found is a lot of people who've got brain tumours, they hear that word and everything blocks. And it's quite nice if you actually turn around and say, well, actually, I've got a brain tumour. Shall we have a coffee? 10 years ago, I never assumed that I would have multiple tumours. And my whole career of 24 years would have to be reinvented. There is a light at the end of the tunnel. And my advice is, find people that you trust and respect that will help you to succeed in what you want to do.
Welcome to Diagnosed, the day that turns your life around. In this podcast, we talk to people with a different medical condition with each different episode. My name's Lee Cunningham, I'm your host for today. Now, today we're talking about brain tumours. Now, brain tumours are one of those diagnoses that tend to stop people in their tracks. Even hearing the words can bring a sense of fear, not just because of the condition itself, but because of the uncertainty that comes with it. They vary widely in type and severity, but what they often share is complexity in treatment, in recovery, and in how they shape everyday life. Today's conversation is about that lived experience, not just the diagnosis itself, but what it takes to keep moving forward through repeated interventions, ongoing treatment, and the realities that follow. I'm joined by someone whose journey is both complex and quietly extraordinary. A woman who has faced significant challenges and continues to live life very much on her own terms. Today I'm speaking with Katherine, who lives on a narrowboat in Cambridgeshire. Sounds idyllic, doesn't it? Katherine has been living with multiple brain tumours, specifically benign meningiomas, and she's undergone numerous surgeries as well as extensive radiotherapy treatment. Alongside that, Katherine's experienced epilepsy and a stroke and has had to adapt to significant changes, including the end of a professional diving instructor career following the placement of a programmable shunt. More on that later. Despite all of that, Katherine's continued to work full-time and brings a very clear, practical and determined mindset to everything that she does. So, Katherine, thank you very much for joining me. How are you?
I'm really good, thank you.
It's really nice to hear from you. We have had a chat a few weeks ago, and as I was saying, I was really glad that we did. So, we're talking today about the benign multiple meningiomas. Have I pronounced that correctly, Katherine?
Absolutely correct.
Listeners probably, they already know this, but I'm not a doctor, and we should say nothing that they'll hear is medical advice. They need to go to the GP or the medical consultant if they feel that they need that for any condition. So, Katherine, if I can take you back to sometime before diagnosis, what did everyday life look like for you?
So this was 10 years ago. I lived on a 50-foot sailing yacht full-time. We have sailed around the Mediterranean, and we were living in a little tiny island called Ios in the Cyclades, very close to Santorini, tiny, tiny island. And I was running a dive school there. And really, really frenetic, busy summers, 180 days back to back, diving all the time. I have 7,000 hours worth of diving. And throughout that season, I was getting regular ear infections, which is not unusual for a diver, but having been diving for 20 odd years, it was unusual. So I kept going back to our local GP and asking for antibiotics, and it cleared, and then it came back, and it cleared, and it came back. So we moved the boat into a winter mooring in Crete, and we went and saw a local doctor there because my ear infections were continuing, although I wasn't diving. Now, being a scuba instructor, you get to know the pressures of your body. So if you get a toothache, you can go to a dentist and say, I've got a cavity in my tooth. And the dentist will say, really? And they do an x-ray and they can find it because it's pressure related. It's exactly the same with these ear infections. You know when something's not right. So I went and saw the GP. The GPs in Greece are fantastic. The first thing they did, they sent me for, I think it's called an endoscopy, where they basically put a really large metal pipe down your nose and throat. And he said, well, there's no problems with your adenoids, there's no problems with your sinuses. I think you should go and have an MRI. Now, again, unlike the UK, you can actually, it's like click and collect. You can go into an MRI office and you can book into an MRI or a CT almost daily. You pay privately. And within 3 days, I got a contact from the doctor, and it was Christmas Eve. And he phoned me up and he said, actually, you've got a brain tumour.
Wow. So was there any expectations going into the MRI? The line just dropped a little bit just before you said that you'd had the endoscopy. So when you went for the MRI, was you just thinking that this was going to be routine, or what was your kind of expectations, if any?
In Greece, the MRIs are kind of much more routine than they are in the UK. So it's used as a diagnostic technique. You know, it's like going and having your bloods checked. It's as simple as that. You book in, they do the test, and within 3 days you get your results. So I thought it was just a routine checkup. Nothing more sinister than that. The GP said, the endoscopy hasn't worked, let's do an MRI.
Okay, and at that time, when they said you have a brain tumour, was that just a single tumour at that moment?
At the point, the GP actually phoned me. We didn't even have a face-to-face. It was like phoning you up and saying, you've got a cold. It was a very matter-of-fact, oh, by the way, you've got a brain tumour. Very much a cultural way of working in Greece. So at that point, they told me I had a brain tumour, nothing more than that.
I mean, that must have been extremely scary.
Incredibly scary, especially as it was Christmas. Christmas in Greece is nowhere near as big as the holidays of Easter, but it basically means you can't contact anyone while Christmas is going on. So I was kind of in limbo.
I mean, it must have been scary, but because we're going to learn about more about Katherine, but did the Katherine mindset kick in that I experienced when we spoke previously?
Yeah, basically I thought, well, okay, we can't do anything about it over Christmas. Once Christmas is over, I'll go and find a neurologist, consultant in the local hospital, and find out more details. Now, interestingly, in Greece, you get all your medical records given to you. So even my scans were given to me by CD. Oh. So you pretty much take all your notes to the local consultant, and that you're not actually referred, you do it yourself. So being practical, after Christmas, we went and found a neurosurgeon in the local hospital and booked an appointment.
And then, so you took your CD or all that information, the results from the endoscopy, the results from the MRI scan to that neurologist. And was it then up to him did he need to do kind of further tests to diagnose it as the benign meningioma at that time? Yeah.
No, basically I gave the CD to him a couple of days earlier in the hospital, and he looked at it before my appointment. And that's when he turned around and said, no, it's not one, you've got lots of them, and we think it needs to be operated on.
So, Katherine, were they localised to one specific area, or were they around in different parts of the brain?
The first one that they needed to deal with was on the right side of my brain. And they said that one needs to be removed straight away. And again, it's very different from the UK. I was pretty much booked in within 2 weeks for my surgery. Having never had any kind of surgery, never broken a leg, never been sick, to be told that I have to go and have brain surgery, and bearing in mind it was in a different language hospital, was quite interesting.
Yeah. Well, I mean, that's one way to describe it. Interesting, you know. I mean, I'm sure that anyone listening to this would be, you know, most people would be petrified at the sheer mention of it, especially given the language.
I do speak some Greek, but again, it's very, very different. Within the hospitals that they have, there's no, they don't provide you any food and they don't provide you with any care. So unfortunately, it was my husband's responsibility to care for me. So to bring in my food and to bring in when I needed to be washed. Unfortunately, through that first surgery, I ended up on life support machine in intensive care for 4 days, which was incredibly scary. And my husband could only come and see me for 10 minutes a day. They eventually took me off the ventilator and they put me into a normal ward. But at that point, I'd stroked down my left side. And that was quite scary. So the operation didn't go well for the first time. They shaved my hair off. I could speak some of the time, but when I was trying to speak, what was coming out of my mouth wasn't what I was trying to say. It was a bit like being incredibly drunk and being very slurred, and, you know, not being able to communicate properly. So that was incredibly frustrating.
I'll bet. I mean, you kind of like naturally led me on there to what I have down as my question is, what was the recovery like after the procedures, plural? But this is going right back to the very first one, which didn't really set a very good kind of precedent in your own mind for what was to come, because I understand you've had multiple surgeries, haven't you, Catherine?
I've had 8 surgeries, and hopefully that is my last one was 8 years ago, and I'm hoping that's going to be the end of it. But that was my very first surgery, and at that point I was not able to wash myself, feed myself, shower or walk. My husband had to do everything for me. He cared for me.
The caring it's a really interesting aspect here, because we're in a different country altogether, and it's the health service there, as you've already explained, is very, very much different to what we experience in the UK. It sounds like it's faster in some ways, but then in other ways a lot more onus is put on, like you say, your husband. So going back, when you were doing the diving you were instructing the instructors, weren't you? Is that what you were doing, certifying them?
Yes, yeah.
At that point,
I trained instructors to become instructors.
Right, okay. And so was your husband doing that as alongside you, with you?
Yes. So as soon as that first surgery happened, I was obviously not competent to do anything at that point. There's no occupational health in Greece. It's a very complicated process.
Yeah.
If you want to do, because there's a huge austerity measures out there, if you want to apply for occupational health, you have to go through a court to ask for it. So in effect, there was no caring responsibility. So it's the family are supposed to look after you. And it's an extended family, so you're supposed to have your parents and your grandparents and your great-grandparents help you. Obviously, because we lived in Greece, it was just my husband. So he used to get me up in the morning, put me back into bed, bring me some lunch that I could eat, come back in the evening and do everything again. So, you know, that was horrendously difficult for my husband, because he was also running our business.
Oh, I can't imagine. I mean, it's that would have been such a pressure, I suppose, like just having to do that. I bet he didn't get much sleep. And how long did that go on for? So what was the length of time from from having very first procedure to being able to at least come out of the hospital?
I was in hospital 3 weeks, and then it took me pretty much 12 months to gain any kind of cognitive ability. So I had to basically learn to speak. I lost all the feeling in my left side, so my face was dragging on the left side, my fingers didn't work, my foot didn't work on the left side. And so we slowly started to do some walking with my help of my husband. And I also started to do some yoga, which also helped, which meant he had to stand behind me so that I could try and get my brain to work. Yeah. And then I had a little, typical like a little water bottle, and I used to squeeze that to see if I could get any function back in there was no occupational health, so we had to be, creative.
Yeah. It sounds like it definitely. I was like really struck by when you were saying about being able to just kind of like get an MRI to order type of thing within a couple of days, but then that sounds almost like archaic in a way that there's nothing afterwards to kind of help you through the getting back to being you after the procedure.
Yep. And there's no benefits at all.
No, again, so your husband is continuing with the diving instructor school, and then having to come home and help and support you. It must have been very, very difficult. So that was the first tumour. Were subsequent tumours or subsequent procedures also done out there in Greece, or were any done back in the UK?
Yeah, I had the second one done in Greece because the problem they got is they weren't able to close my skull up properly. So it was pretty much a disaster, the first surgery. So the surgeon wanted to go in and have a look and see if he could reduce the pressure in my skull. And again, remove another tumour. Again, that didn't work particularly well. So after the 2 surgeries in Greece, we then because we'd been paying our taxes in Greece and it was our home in Greece, there was absolutely no reason for us to come back to the UK. But we were advised by another consultant of ours that we should speak to the John Radcliffe Hospital in Oxford and ask their opinion. And now what's interesting is because I had all the medical evidence and the CEDs to send to them, we basically sent the whole lot to them and said, could someone advise us on this?
So John Radcliffe Hospital in Oxford is, in one of the emails that I've read, it talks about the cranioplasty and that whole process. I'm not sure whether I'm kind of going into that a little bit prematurely. Am I?
No. But basically, they came back to me and said, because you're not in the UK, we advise that you come back to the UK, but it's not going to be NHS. They've got a private facility there. The John Radcliffe neurosurgery is phenomenal. They are incredibly gifted people. They have a massive team, so you don't see one consultant, you have a team of consultants. So you have someone that's specializing in tumors, someone specializing in skulls, and it's a whole team base. And they said, you can come back to the UK, but you're going to have to fund it yourself. Now, in Greece, there's an interesting law that if they can't do the surgery in Greece, which they couldn't do, they have to fund you back to another country to do the surgery there. Now, this used to happen really, really normally when we weren't part of Europe because of the austerity measures. Again, we had to take them to court to see if they would fund my coming back to the UK. Unfortunately, they said no. And we ended up finding a fantastic charity that would actually fund me because they didn't know how much it was, because until they actually split open my skull and have a look, it's like how long's a bit of string.
Yeah.
They don't know. So I came back to the John Radcliffe, and they did my third surgery, and they basically managed to put the cranioplasty in. Now, because they had removed so much of my skull, the only place that they could do it was Australia. So they took a CT of my skull, sent it to Australia, 3D printed it and FedExed it back to the UK, which is awesome. I saw it before they put it into my skull, which was quite incredible to see. And they put that in. Unfortunately, when they put the skull back in, there was too much brain fluid in my head and it wasn't working. So that's when they put the programmable shunt in, which basically means they take the brain fluid out of your skull and pop it through a tube into your stomach, so that your head doesn't explode. They did a fantastic job. Unfortunately, by doing that, I could no longer scuba dive anymore because there is no liability insurance for that. So they fixed it. So they put my skull back on and they put the programmable shunt in, but it basically rendered my career gone.
You have so naturally come on to what I've got on my podcast host sheet here, Catherine. So thank you for that. When you said that career, that professional life in like teaching the diving instructors to get their qualifications, was that one of the more difficult things about this for you? Or did you kind of suspect that might be on the cards anyway at any point?
I'm a very practical person, so I did some research as to what I could and couldn't do, because being an instructor, to train instructors, you have to make sure you're well above the minimum requirements. So I went and found out what I couldn't do. For example, if you're pregnant, you're not supposed to dive. There's no evidence of it. No one's ever done any medical assessments of what happens if you're pregnant and you dive, but they've made it exempt. If you are pregnant, you shouldn't dive. So it's a very similar thing with the shunt. We don't know, so you can't do it. I assumed that if they just put the cranioplasty back on, that I could live with my brain tumours and go back and do my old life. But they basically destroyed that life. They destroyed my business, because you can't run a dive school when one of your senior people can't do their job anymore. No.
So that sounds like it's like a difficult turning point. And the result of everything that had happened right up to that point. I'm sure there was more to come, because you said you was on your like third surgery, I think you said, but by this time, when they put the programmable shunt on, and that was a point when you realised that you wasn't going to be able to run the diving school.
Yeah, absolutely. So because I had come back to the UK and I was on the UK systems books now, they did the 12-month check. So let me clarify, I had two surgeries. One was the cranioplasty and the second one was the shunt. They couldn't do them at the same time. They put the cranioplasty in first, and then because the pressure was wrong, they had a second surgery. So I had another scan. 12 months later, I'd gone back to Greece for a year, and was doing the administration but not diving. Went back to the UK, had another scan, and one of the tumours had grown. It was on my eye socket on my right-hand side. So the potential of that was, if they're going to remove, they're called receptacle, the optic nerve. So they're basically scraping the optic nerve for the tumour. There's a possibility I would go blind. We decided that we would sell the business and our yacht in Greece and return to the UK, because the conversation I had with a consultant was, at this point, I had multiple meningiomas. They'd counted 24, and this was going to be an ongoing requirement. And we made the terrible decision that we needed to come back to the UK and have it checked out here. So I had the surgery done in Oxford. They managed to recept the optical nerve. By doing that, I lost all the colour in my right eye. So I'm a qualified skipper, which means I can't actually skipper at night because I've lost the green and red visibility in my right eye. So unfortunately, that was another career option that kind of disappeared. So it was kind of a reset option.
Yeah. So you'd lost the ability to do the diving instruction, and then maybe a fallback as a skipper, using the skipper qualifications that you have, as now that's defunct as well as a result.
Yeah, it wasn't a good day, to be honest with you.
No, it sounds like on the contrary. And this is where I think, when we spoke before, and I think a lot of people listening to this would think, like, where do you muster the strength that now when you come to, not just the enormity of, from day one being told, you have a brain tumour, to that being multiple tumours, to then going through, like you said, disastrous surgery, or two disastrous surgeries in Greece, and then these dead ends to the career. But despite that, you've continued to work. Is that full time? Am I right in saying that you work full time?
Yes, I do. What happened with me was my first consultant, Mr. Kerr, was a fantastic person. He basically gave me all the bad news, and then said, it's completely up to you what you want to do. He said, you can do anything you want. This is the really bad news, but you can avoid it all. It's all about attitude. And what was interesting in those 3 surgeries in Oxford, because I'm so used to being in a Greek hospital where you have to do everything yourself, I'm not used to having my food delivered to me or being offered if I want to go to the toilet or shower. I was quite a proactive, practical person. And I watched how different people reacted. And, I would be out of my bed within 2 seconds of being back in my bed. And my consultant said, you need to be active. If you don't be active, then everything goes wrong. So I would get up, and much to the annoyance of the nurses, and do a couple of steps backwards and forwards to my bed, backwards and forwards to my bed. And it was interesting because I always got discharged first, because the first thing out of my mouth with a consultant is, when can I go home? I love this hospital, but I want to go home. And that's basically how I've had to live my life for the last 10 years. After those surgeries, the tumours had grown again, and they offered me radiotherapy. And that's a horrible situation to go through. It's intensive. They tell you that you should never work. You should sit at home. It was a 30 session, so 5 days a week. So Monday to Friday, they basically put you in a mask. They zap you with a microwave and send you home. And I went to the consultant and said, no, I want to work. Well, you can't. I said, why? Where does it say that I can't work? Why do I have to sit at home and cogitate that you've microwaved my brain when I can go and do something productive in the afternoon? And, well, you're going to be tired. I said, I'm tired anyway. I work full time. And eventually, the consultant agreed. And I had this first session of the day. I got to meet lots and lots of the other patients who are on chemotherapy, because we had to sit in the same room, and we ended up making really good groups and good conversations, and hopefully I did something good to help them. So it's all about attitude.
Yeah, definitely. When you put in the email about it felt like you was having your head microwaved, it sounded to me like clinical and surreal at the same time. I think also not only that, the intensity with it being every day over 6 weeks, I think you'd said, and obviously the travelling to and from the hospital and then the procedure itself. It's absolutely commendable that anyone would go home and work after that. So you were effectively told to slow down, and you responded
Yes.
in a way that I'm absolutely not gonna slow down.
At the end of the day, you've got two choices. You can listen to all, I fully understand that the doctors and consultants and radiography have to tell you the worst situation. But it doesn't happen to everyone. It happens to some people, which is terribly, awfully horrible, but it doesn't happen to everyone. And from all my journey with these brain tumours, going to work means that I can do something useful for that day, rather than sitting at home watching daytime TV and losing a little bit more of my brain power. One of the things I found a lot with the brain tumours is if you don't keep active and you don't think and you don't have routines, I've lost a lot of my cognitive ability because of the messing around in my brain. So sometimes I'm really, really good at numbers. Sometimes I'm really, really bad at numbers. Sometimes I'm absolutely great with the timekeeping and appointments. And other times I have to put it on my phone to make sure I'm available to do that. And it's one day after another. But you can't just sit down and say, well, because I can't tell the time and I can't do money, I can stop doing that. You just have to, in my opinion, push on and smile about it and tell people how it works.
I mean, just even that as a guidance, push on and smile about it. Have you always had that kind of mindset? I mean, where does that come from?
I was brought up a lot by my grandmother. My family were military, so my grandmother was a huge support for my parenting. And my grandmother always told me, you can do anything you want. She used to hand me a recipe book and said, make anything you want. No one told me that choux pastry and puff pastry were difficult. I just looked up the recipe and it either worked or it didn't work. And I think my grandmother gave me a great deal of influence. She said, I can do anything I want to. You just have to work hard at it. So I think a lot of that came from my grandmother. The rest of my family were, a lot of it was very negative. Oh, you shouldn't be doing this. You shouldn't be working. You shouldn't be doing this. You shouldn't be doing that. And I frankly ignored them. But what I found is a lot of people who've got brain tumours, it's a bit like cancer. They hear that word and everything blocks. And it's quite nice if you actually turn around and say, well, actually, I've got a brain tumour. Shall we have a coffee? And it's not that scary. And, this is what's going to happen. This might happen. Yeah, they're going to shave your hair off. When you have radiotherapy, your hair might fall out, but it comes back. Some of it comes back. Some of it doesn't come back. Yeah. You can wear a wig. You can wear a hat. It's up to you what you want to do with it. And I think that's really important. We're not survivors. We get on with our lives. Life's too short. 10 years ago, I never assumed that I would have multiple tumours, and my whole career of 24 years would have to be reinvented.
Yeah. The mindset thing is of particular interest. It's always been my kind of genre of reading, much to the kind of the frowns of the other people that say why do you read all that stuff? And I say because even if it makes you feel, you can learn something from every single interaction. And I've always believed that most of the books, the kind of books that I read say exactly what you've said, that you're always going to get the naysayers, and yet the kind of attitudes that you got from childhood through grandma last a lifetime, and so fortuitous to have experienced that. If you could bottle it and sell it, you would make an absolute fortune, wouldn't you? Because I think that it takes root in youth, and I think it is difficult for some people that haven't had that that during the susceptible years, when you're very young, if they haven't had that kind of attitude surrounding them like you perhaps did with grandma, it's very difficult for them to change, to make a positive change. Perhaps do it in the moment, but to give it longevity isn't perhaps so easy.
No, I fully agree with you with that. Don't think that I don't have bad days. I call them duvet days. Sometimes I just don't want to get out of the duvet. Put the duvet over my head and stay there. But that, everyone has those days. Your pet dies, or a family member dies, or you're having a bad day. We have those days. I've had those days when they've come to me and said, "Oh, okay, your scans come back, but there's another growth. We need to do something." I don't go out of that skipping and jumping. But after I've dealt with that process, you have to work out what's the best option for it. And it's down to, am I just going to fight it? Or am I going to have a better attitude? Or is there another way I can work it? And I do think that we have a lot of situations where I was offered counselling. I was offered a carer. I was offered, in the UK, occupational health. And I spoke to the lovely lady and I said, what do you think I need to do? So she did the test and she said, well, frankly, I don't think you need anything. I said, well, thank you very much. Well, then I don't need anything.
Yeah.
But you've been given this as a option. I said, yeah, but give it to someone else who really, really needs it. If I don't need it, give it to someone else. And I think that people don't even give that as an option. If I'm capable of doing it, I'm capable of doing it. I rely, to be absolutely honest, 100% with my husband, because some days I'm absolutely on the ball and other days I'm not. And he's got used to that, because pre my brain tumour, I was pretty much on the ball all the time. And sometimes we'll have the same conversation and it goes out of my head and doesn't come back. But then I've adapted. So I have notes. I have on my emails, anything I speak to a customer over, I put on an email so that if I can't remember the next time I speak to them, I can say, oh, we had this conversation last week. How is your mother? How is this? It's just working around the situation.
Yeah. It's fascinating how you've reinvented yourself. I was actually taken by what you said about Mr. Kerr saying you can do anything new. Did you say Mr. Kerr? Yeah.
Yes, Mr. Kerr, yeah.
Mr. Kerr saying you can go and do anything you want. You can choose. You've got that option. I don't like to generalize at all, but not everyone's the same, Catherine. And I would imagine that some people are offered all that support that you mentioned earlier, possibly including medications as well, the antidepressants and things like that, and just absolutely snatching the hand off the GP or the consultant and taking anything that's offered. You mentioned you run to improve your state of mind and keep motivated. Is that right?
Yeah. It makes me feel better. I was offered antidepressants. I was offered counselling, but I've seen some some people it works with, other people it doesn't work with. So for me, it's doing something, sometimes I can't walk more than a couple of steps. But if I try and do that, it means I'm trying to do something to make my health a little bit better. And it's, again, down to attitude. When I spoke to Dr. Kerr,
definitely.
And I joked with him that first time. I said, when can I go back to the gym? And at that point, he'd got 56 staples in my head, because they don't do stitches. It's like pretty much a metal staple in your head. I had 56 staples in my head. He said, you can go as soon as you want, but I suggest you wear a cap, because if not, you're going to scare people. That's the attitude you want to have. Yeah. And then, when I went back to the GP to have the staples removed, they completely freaked, because I had 57. I said, just count them in, count each one in, 1, 2, 3. And they went, doesn't that bother you? I went, well, the consultant says I got 57, so we need to take 57 out. It makes no difference. And, you have to laugh a little bit, There's nothing you can do if you've got 57 staples in your head. But Mr. Kerr basically said, you can go to the gym, but I'd suggest you put a cap on. Bearing in mind they've shaved my hair off, so I did look a bit scary.
That's what it is. I've got to ask you a question. Is there anything that you think you've personally become better at through all this?
I've changed my career, which I never thought I would be able to do, because I kind of thought that I would stay with the diving and sailing until I retired. So, 10 years ago, I had to change my career. What I am very aware of is that you can be that flexible. So it's... I never thought that I would be able to do that, but I actually amazed myself that I was able to do this. And what I do now is I work with people that are in a similar situation, and I sometimes give them advice, and sometimes I don't. But that was a little bit of a different situation. I thought I'd do this until I retired, but it's not going to happen.
Yeah. I've taken a lot of your time, Katherine, but I mean, personally, I could talk to you all day. I said that last time we spoke, but I'm going to ask you, I think just one more question, if that's okay with you. Is that okay?
Yeah, go for it.
Yeah, so what would you, and it sounds a bit cliche, the question, but I think it's really important, because I think that for someone that may just have been recently diagnosed with a similar condition, the value of listening to someone like yourself is immense. So what would you say to someone that's facing a similar diagnosis?
It's a scary, scary situation, and it's a long, long journey. But there is a light at the end of the tunnel, and my advice is find people that you trust and respect, that will help you to succeed in what you want to do. If you find someone that is going to be completely negative, you should sit at home, you should wait, you should not do this, you should not do that. If you can find someone that says, well, if you want to go skiing, if you want to do rock climbing, go for it. It's a long, long journey, and you think you're getting to the end of it, and then you've got that lovely consultant that sits opposite you and says, this has changed, that has changed, and you kind of go dip down that slope. So you need someone that's going to pull you back up and dust you off and say, right, let's start again. And it is scary, but there is life outside brain tumours, and you can live a happy but different life with brain tumours.
That's incredible advice. It reminded me of something that I heard when I was very young, and I'm not very young anymore, but and I remember it almost word for word, and it said something like, it sounded like a paradox because the phrase were, we can never outgrow the limits that are placed upon ourselves, but we can set new limits within which we must live, and we can continue doing that. So being surrounded with positivity and understanding, rather than the naysayers and the negativity, is really important. That's quite profound. I think what's striking about your story, Katherine, it's not just the scale of obviously the enormity of that initial diagnosis and everything that happened afterwards, but it is the incredible way that you approach it. And I am so genuinely honoured to have kind of met you through UID Me, and for you to have got in touch, because if I had a choice of talking about this particular diagnosis, you would be first in the queue, just down to the extraordinary kind of attitude that you've shown. So thank you from the bottom of my heart. I really appreciate it. Well, we'd have loved to talk to Katherine for much longer. There was so much to cover, but she was on a narrowboat and the line was a little bit choppy. We managed to edit a lot of that choppiness out. But she has agreed to come back and speak to us again, possibly in season 2, about the epilepsy and the stroke that was caused by one of those earlier procedures that we spoke about. I'm sure that you will agree there's so much more to talk about with Katherine, and we're really grateful that she's willing to share her story and continue to come on to diagnose the day that turned your life around. Katherine has also very generously offered her time to any listener that may have had a similar or same diagnosis. I'll put the email address for you to do that if you've been touched by any part of her story on the screen at the end of this, and I'll also put it in the description, so have a look around for that and you can get in touch. Katherine, your tenacity, your clarity and your determination really stand out. The way you've approached everything that you've faced is remarkable, not in a dramatic sense, but in a very grounded, real and powerful way. I really thank you sincerely for talking to us and taking the time out to speak to us on Diagnosed, the day that turned your life around. And of course, you, the listener, as well. Thank you so much for tuning in. These are not short episodes. I really appreciate your time. Don't forget to share us, like us, share the podcast with your family. Or if you know someone that's been personally touched by the stories that we share, then send them a link to it. It really helps us, and it'll help us bring you more stories, real life stories from real people on Diagnosed, the day that turns your life around. Thank you so much. Bye bye for now.